Hello everyone, my name is Navdeep and I am a registered nurse in Australia for last 8 years and currently I'm practicing as a community nurse. I am going to present on a topic which can be very helpful for my newly joined community nurse colleagues, and they can also be helpful for some community nursing students or who are planning for coming on a community nursing placement. So this topic actually talks about various types of funding that as a community service providers we get. So we can provide home services to people in their own homes. So without wasting any time, let's start with it. So my aged care is something which takes into account all the funding programs or services based on the requirements of a person. The aim is to keep them independent at their own home for as long as possible and as much as possible. So there are different levels of programs which Australian government is funding at this stage to help them. So my aged care is the entry point where all these things start, all these things begin. So any person or any Australian over the age of 65 years of age can access my aged care for getting some services at their home, and these services are eventually funded to them by my aged care, and then community service providers come into play for utilizing that funding in order to provide that service. So how all that works, we'll discuss about that in detail. So looking at some statistics from Australian Institute of Health and Welfare, in 2021 to 2022, approximately 800,000 people over age of 65 years have used some kind of home support programs, out of which 65% were females and 23% were between 80 and 84 years of age. So that's a big number. The Australian government spends a huge amount of tax money on aged care sector. Looking at 2021 to 22 financial report, government expenditure on home care subsidies and supplements was $4.4 billion compared to $4.2 billion in 2020-21, which is a big money. So that's just giving you an overview of how big aged care sector is in Australia. So what type of aged care is provided? So there are three main types. We can divide it into CHSP, which is called Commonwealth Home Support Program. Then comes Home Care Package, which is HCP. And then finally Residential Aged Care, which is the last resort. So to begin with, if someone needs a little bit of help just to just around their home or activities of daily living, such as just assisting with their medicines, or they need a bit of help with the showering, that all comes under a entry-level program which is called CHSP, which is Commonwealth Home Support Program. It's entry-level funding given to the residents over 65 years of age, which is utilized by community service providers. Then is home care packaging. Say if someone was initially getting just nursing visits every day for helping with their tablets, but now they have deteriorated functionally given the age factor, given the comorbidities, medical conditions, family circumstances. If they need more support than just the nursing service, then they can be assessed by aged care team again, and it can be possible that they may be deemed eligible for some kind of home care package. There are different levels, level 1, level 2, level 3, level 4, based on their needs. So level 1 is like just basic care needs, level 2, 3, 4, their needs increase, and level 4 means highly dependent. So it's more funding, more support than Commonwealth Home Support Program. So usually home care packages are case managed, whereas CHSP is not case managed. So the last resort is when they cannot stay at their home without any medical supervision or family supervision all the time. Then residential services, residential aged care is the last instance where they can be put into an aged care and it is a family decision. Next of kins, their medical power of attorney, their enduring power of attorney is considered into account. Their advanced care plans are considered into account before making that decision. So it can be permanent aged care, they are given a permanent placement, or it can be respite. Respite means they are getting aged care but for a temporary period of time, just so that family or carers can get a bit of a break, or the person just wants to see how they feel at aged care. Are they liking it or not liking it? Because it's a very hard decision for them to leave their own home and then get settled into an aged care. There are some extended support programs which we can see in community. One is TCP. It is transitional care program. Usually someone who has been discharged from hospital stay for a longer period of time, such as someone who had stroke, discharged from hospital and now needs a bit of nursing support, physio support, or a bit of other just for a short period of time. If they need those supports after a long hospital stay, then in these kind of situations they can also be put on a TCP based on availability. Next, another is short-term restorative care, which is also called STRC. As the name says, short-term. Short-term means where early intervention services are given to reduce difficulty in everyday tasks. This can be like if someone is discharged from hospital on insulin, they need a bit of education and support around self-administering insulin, dialing up correct dose, managing high blood sugars, low blood sugars, what is the normal blood sugar reading, what type of food they have to have, bit of education and support around that for a short term. That kind of service can be short-term restorative care or STRC. It's not it stops after a while. It can be 3 months STRC, 4 months, like that, based on what level of support is required. Then another is DVA, which is called the Department of Veteran Affairs Community Nursing or Veterans Home Care Services. These are for ex-defense personals. They are given all their subsidized health services at home or in hospitals under all DVA programs. There is something for people from birth to 65 years of age. As we all know, over 65 years of age, everything is controlled by MyAgeCare. But when someone is under 65 years but has some medical conditions, is unable to work, is earning a low income, is at risk of homelessness, all these situations can come under HAC PYP program. It is covered by Department of Health in Victoria. It is called Home and Community Care Program for younger people from birth to 65 years of age. This is for this one does not require any MAC involvement or MyAgeCare involvement. Community service providers utilize all these government-funded programs to provide health services to eligible Australians in their own homes. So community service providers can be any independent companies or not-for-profit companies, or they can be like an organization which is ready and utilize this funding to provide the services at home. But in order to provide services, they need referrals. They either need a referral from their health professional, maybe a GP is sending a referral to the community service provider to go and provide home visits to this particular person. They can be their specialists who are making the referral. It can be a treating team in the hospital. Sometimes clients or their family members, next of kin, can make these referrals directly to the community service providers. Then MyAgeCare sometimes can also make a direct referral to community service providers that we want you to go and visit so-and-so person for so-and-so care. Like, for example, a person needs assistance around continence management. They are having continence issues related to their age, or they have had a surgery, so they need some continence advice. So things like that. So MyAgeCare can also put a referral to the community service providers directly. So sometimes this can work out alternatively, like family member or a client has rang my aged care that I need help with my, say, a person's daughter rings my aged care and says, hey, I need help with my mother. She's missing on her tablets. She's missing on her food in the mornings or late at nights. We need a bit of help around her. She's unable to shower herself. She is 80 years old. We need some help around that. So my aged care will assess the situation. They can assess it on the phone. They can assess personally by coming and visiting them. Once my aged care or MAC makes an assessment, they will make referrals to the required services. They can make a referral for nursing service to one community service provider. They can make referral for a physiotherapy to another. They can make referral for their garden maintenance, home maintenance, like that, based on the level of services required for them. So as community nurse, when we go there, we have to understand what is the MAC referral process. So for people over 65 years of age, when we go in their home and we see that they don't have a MAC number or my aged care number, which means my aged care is not aware that this person needs some support at home. So as community nurse, it's our duty to make a referral to my aged care to inform them that we have started coming and providing some sort of service for them at home. So for that, you need to get consent of the client first of all, and then their Medicare details are required, and you can make an online referral. There is an online My Aged Care referral form for health professionals. You can utilize that to make that referral. There can be another scenario where MAC or My Aged Care has already sent a referral to you, which means my aged care knows that this person needs some help with their maybe medications or maybe wound dressings or so, or maybe catheter management, and they have asked the community service provider to come and have a look at this client and assess the situation and start with the services whenever possible. So in that situation, when they already have a MAC referral in place for you, you need to log into the MAC portal, find that client's file on MAC. Every person who is getting services from My Aged Care will have a unique ID number on MAC portal, which is called My Aged Care portal. So you log in, you find them using their MAC ID or MAC number, and you update the details of the service that you have started. For example, you have started making home visits as of today, and you will be making those visits maybe every day for assisting with the medications and stuff. So you need to update the frequency of that service on MAC portal. So MAC will need to be updated from time to time. It's not like once you commence the service, you have updated MAC and that's it. It's not like that. MAC needs to be updated if care frequency is changed or circumstances of care have changed. For example, you initially only came twice in a week just to assess the wound on the lower limbs. But now they need help with their medications because they have had a recent fall and they have had a decline in their general health. So in that situation, you might have to start daily visits for them to help with the medications. So you need to update the care changes and the frequency of the change on MAC portal as well. If a client is discharged from your service for some reason, say they are admitted and they are having a longer hospital admission, then you update MAC. They are discharged because you have completed the service. The wounds have healed. They no longer need you. Then also you will update the MAC that you have completed the service. If a client is deceased, unfortunately, then you have to update MAC. And if a client is going to another service provider, then also you will update MAC or My Aged Care. I think that's all about this. I have tried to explain MAC portal, MAC, CHSP, home care packages to the best of my ability. If you have any questions or comments to make, please make sure to write them below. And don't forget to like, share and subscribe the video if you like it, and please write down the topics you would like for the future. Till then, thank you. Bye-bye.